All right, welcome everyone. Thank you for joining us in today's Eagle Talks. I wanted to go ahead and let you all know that this meeting is being recorded. We do share our events over at our SLDP YouTube page. So, in case you ever want to go back and visit us over on that end and check out other events that we've had here on Student Life, you are more than welcome to do that. I will go ahead and share our YouTube channel here in the link. So feel free to go ahead and check us out. Also, we will be sharing again this event on that YouTube page. So in case you want to share it or watch it again, you're more than welcome to do that. So thank you so much to everyone who's joining us today. We really appreciate you all. We want to go ahead and get right started to respect everyone's time here. Today we have a really special guest. We have Dr. Milan Corona that's joining us today. And the conversation about today is in regards to World Health Day. In case you haven't heard of World Health Day before, it's a day where every year it's celebrated to bring light to important health issues such as mental health, maternal and child care, and climate change. And this campaign highlights World Health Day's constitutional principle that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition. So, on the occasion of World Health Day 2021, this year the theme is building a fairer, healthier world. So, I will go ahead without further ado and kick it off to Dr. Milangela Corona, who has been so gracious with her time to join us. And I will go ahead and have her introduce herself and tell us about her journey and just anything related to World Health Day. So, thank you so much, Mila. The virtual floor is all yours.
Hello, thank you, Marisela. Well, first of all, thank you for inviting me. I was telling her I was a little bit nervous about like participating in here, but I'm gonna talk with the heart. So to introduce myself, to tell you a little bit about my story, I'm originally from Venezuela. Venezuela is in South America. It's not part of Mexico. A lot of people mistake that. I'm from Venezuela, and I graduated as a medical doctor over there. So I graduated actually when I was 22 years old. The system here to become a doctor in the United States is very different to other countries, even in Mexico too. Um, in my country, you graduate from high school, then you take a bunch of tests, and then if everything's good, you get into the program of medical school, right? So, and the big difference here is that everybody knows here that to be a medical doctor here in the United States, first, it's super expensive, super competitive, and first you need to have 4 years of college, right? And then you need to apply for medical school. Medical school is other 4 years, and after you graduate from medical school here in the United States, you're not a doctor yet. You need to apply for a residence program. That's another 3 years. So in total is 8, 7, 8, 9, 10. Like you're in school for like 10 years, right? And in that's a lot of money too, right? Some people are like in debt for like $300,000. So that's the big difference, like with the schooling part here. Some people, when they graduate from medical school here in the United States, they need to apply for the residence, right? So after they graduate from medical school, they're not doctors yet, and they have a bunch of uh, student loans, but they're not doctors yet. So they need to apply for the resident program. What is the resident program? You want to be a pediatrician? You want to be an OBGYN? You want to be an internal medicine doctor, etc. Those are 3 years. And after you graduate, then you become a doctor. But some people, they don't get into the resident program. It's very competitive to get into the resident program. So you have people that graduate from medical school competing to get into these programs, right? And some people, they can't get in, and they end up with their medical degree, but without the doctor part, right? So that's when I came in. because in my country, I graduate from medical school. I was able to work. I was able to work a full year before I got married and I came here. Um, but I was a licensed practitioner over there. So when I came here, I had to apply with everybody else to get into the residence program. Like basically, I was like a family medicine doctor over there, but here I needed to apply to do that again, right? To do my residency all over again. And like I say, it's very competitive and expensive. So I put that on hold. And well, I marry a teacher. So, and my dad is a teacher. My sister is a teacher. My in-laws, like my brother-in-law, like basically all the family of my husband are teachers. And so I remember when I was in high school, and my sister, she was already a teacher, and my dad is a math teacher, math and physics. I remember like thinking that I was like the black sheep of the family because I wasn't a teacher. And I went to this doing this medical thing, and now now I'm a teacher. I'm actually a professor for San Bernardino Valley College, and I'm a teacher too in Chaparral High School in Temecula. So I was able to use my medical knowledge. I was able to apply that medical knowledge without having a license here, to teach others. And well, that's what I'm doing right now. But I was talking to Marisela, and she wanted me to basically share my experience of how the medical system is different here in the United States, and in my country. I'm just gonna talk specifically about my country because that's my experience. But my experience is very similar to other countries like Mexico and South America. So
Mila,
yeah,
we have a few more participants that have joined us.
yes.
Can you just mention the country that you came from?
Oh, Venezuela.
Okay, perfect.
I'm from Venezuela.
Thank you so much. And then while I've already interrupted you, I wanted to go ahead and let students know, and I also have Associate Dean Maya who will have introduced in just a second. But
Okay.
if you have any questions, feel free to jot them down in the chat or unmute yourselves and ask Dr. Corona. She is more than happy to answer any questions along the way. So don't be hesitant to interrupt. So thank you so much. Sorry, Mila.
No, no problem. Oh, I see. Jenny Lee.
Yes, that's
She
Janelle.
said Janielle. Yeah. Okay. That Janielle. A lot of people do that. Um, I know a lot of people. They graduate from high school, and then they go and apply for medical school. Even you can do it. I think in Puerto Rico too, in the Caribbean islands. You can do it in Mexico. Okay. All you need to do is get your medical degree. And I don't know how much it is in Mexico, but in my country it was free. Like the government paid 100%. My medical school was 100% free. And but that medical school, yeah, it needs to be in a list of like international medical schools. Like mine was in that list. So for the it's called Educational Commission from International Medical Graduates. I'm gonna put it here just in case, so you can see the list of all the schools that they accept. Let me just type it here. International Commission for International Medical Graduates. So if you want to just check like the list of schools that they approve, you can go ahead and like look for the International Commission of the what? Well, I sorry, I forgot. Well, those are the letters, right? So I remember when I was studying for to getting into the residency, there was a lot of people from Mexico, like the same age as me, and they here it's like free health care. Well, yeah, well, but it is free medical school, yeah. So my when I translated my transcripts, absolutely, I'm just here listening to um yeah,
Sorry
when I
about that.
trans
I was messaging Maricela.
oh, no problem. When I translated my transcripts, it says doctor in medicine, which is the same as a person that graduate from medical school here. But then everybody has to apply for the residency, right? That's when you have to take uh, the um, the board exams, or this step one, step two, and step three exams for to to get into the residence, right? That's when everybody like comes to the country, like people from Mexico, people that went to school in the Caribbean, and they everybody there, everybody's at the same level. Everybody has to pass, and we are competing for the spots in the residency. The problem is like people that graduate in they don't graduate here in the United States. They're putting like in the second. I'm not gonna say the last uh, part of the list, but when it comes to time of picking people to get into the residency, they always gonna pick people that graduate here first, because they have a lot of student loans, and is basically the, like, and then if they have spots left, or you have a super higher um you did excellent in the test, and you have like research, and you are like an over the top person, then you can like override that part of graduating here. But then if first they take people from the United States, and then they start getting like international medical graduates.
Dr. Corona, I'm wondering, is there a doctor shortage sometimes that you've experienced that's why they need to pull from these lists?
Yes, especially in California, I remember they needed a lot of family medicine doctors, a lot of family medicine doctors. And why is this? For two reasons. Like I say, when you graduate here, you have a lot of student debts, right? So everybody wants to be a surgeon, because that's what pays the most, right? So nobody wants to be a family medicine doctor, because they don't get as much money, because they wanna pay their debt fast, right? So all those spots for like being a surgeon and being like a neurosurgeon and all that are packed, right? And nobody wants to be the family medicine doctor that like, you know that goes in the community and stays in the community, right? They make a lot of money too, like in comparison, but like between doctors, that they see the family medicine doctor as, nah, you know, they just want to be a surgeon. So, and in the communities here, people are so used to going to the doctor when they're dying, you know, um, and there is not that cultural thing of going to the doctor every year or every 6 months, because here it is a hassle for insurance, for, yeah, basically for insurance purposes. People go to the doctor if they have an accident or if they're dying, okay? So they wanted to implement that family medicine or primary care. uh, they wanted people to have more primary care, so they wanted more doctors, like international medical graduates, and especially bilingual international medical graduates, especially in California. So that's why that's the shortest. So if you are bilingual and you want to try, I know they need a lot of international medical graduates. After profit and make it to
Yeah,
pay.
so in the chat, that the question Janelle asked is, so they're really after the profit they make to pay off their student debt for those who went to school here. Um, do you have
Yeah,
an answer?
yeah, yeah. Like when I was studying for the steps for the to get into the residency, uh, I remember, like, talking to the other medical graduates from here, because we were all in the same pot, right? The people that graduate here, and they were saying, like, I'm broke. Like, I'm like, I remember one girl. She was the only one that wanted to be in the family medicine part. She's already a family medicine doctor, by the way. And I remember her, like, telling me, like, I'm gonna be a poor doctor for, like, she knew she was gonna be a poor doctor. So all of the doctors, they are with this mindset that if I want to make money or profit, I need to be a surgeon. Nobody wants to be in the primary care part. So can you talk about salary in general? Okay, the salary for a primary care physician, it can be in the 100,000 easy, which is good, right? In comparison with, but in comparison, but imagine that you have like $3,000, $3,000 dollars in debt, right? Or some people have more. So in comparison with a surgeon, they can make like 400, 3,000. I say 300,000. I'm sorry. And a surgeon can make 300,000 or 400,000 a year, because they make more money with the more surgeries they have. You, as a family medicine doctor, you don't make more money as like some every time you see a patient because they have high blood pressure, you know. So imagine you see a patient with high blood pressure and diabetes, and you compare that with a surgery, which is here is like the prices right after taxes. Yeah, yeah. So imagine that your school was free in Mexico or in my country, Venezuela. So all you will take all the profits, right? If you so it makes sense.
I had a question, Dr. Corona. How does it, so if you're a doctor in Venezuela, how does that vary from here in the US? Because I feel like here in the US,
Yeah.
doctors seem really overworked. And I have a cousin in Mexico who normally is at home. And if he gets a call that there's a patient in his doctor's office, then he heads down to work and then kind of come back. Lives a very different lifestyle, I think, than
Mm-hmm.
a doctor here in the US. Could you elaborate on that?
Yes. So it's I think honestly I think it's like a cultural difference. Um, because I we especially in my country and in Mexico too, we treat the people like the equals. You know, we touch the person, we touch the patient, we examine the patient. Here people are the doctors are like afraid of touching the patient. They don't want first they don't want to get into a lawsuit for anything, right? Cultural differences, like for example in my country we hug, or like, or we talk about, like, I don't know, oh, how's your son, or oh, maybe people will bring me like food, right? So
So you
hi,
build, you're able to build like a deeper
you build a
relationship, right?
relationship with people. It's
Mm-hmm.
like family, okay?
Mm-hmm.
And here is super distant. Like they like to talk to a doctor. First, you need to make an appointment with the medical assistant, and then they have the medical assistant, then they have the nurse, and then they have the back nurse, and then you see the doctor for 10 minutes, right? And in Mexico, for example, you make an appointment with the doctor, and the doctor is like, I have doctors, Mexican doctors here in my WhatsApp. My dad, he has a brain cancer, and like I will text the doctor. I will text, like, my dad just had a seizure, for example, what should I do? And he will reply to me in 5 minutes. You can't do that here. Like, the doctors here are not like that, right?
Mm-hmm.
And they have that, that wall of, I don't want to say I'm more important than you, but I think it's like to protect themselves from lawsuits,
Mm-hmm.
actually. Like, they don't want to, I don't want to touch. What if I touch this lady? Like, even like if you get if you get a pap smear, for example, if you're a woman, right? They have to tell you, right now I'm doing this, and listen, I'm touching to this, and like, you know, everything is like very robotic. And in my country, like, we are not like that. So people feel more comfortable with you to sharing things about their lives, or whatever. So
Hmm.
it feels more, you know.
Yeah. And I imagine that the patient to doctor ratio is also really different. That's what also helps create that
Yes.
that different dynamic.
Yes, because people over there are used to go to the doctor for whatever.
Mhm.
For my toe hurts, like my finger, you know, my finger
Mhm.
hurts at 3 a.m.
Mhm.
in the morning, because it's free. Now the healthcare over there is free. I'm not saying it's better, but it's free. So it culturally, if I have my baby and my baby had a fever, I'm just gonna go to the doctor right now, and I will check their baby. Right here, if your baby has a fever, you say, should I go to the emergency room? I need to talk to insurance. Is gonna cover it? How many hours do I have to wait in the emergency room for the doctor to like say go back home? Because sometimes, especially like first time parents, they over there, like, they go to the doctor because the baby is like sneezing, right? So they want that reassurance that the baby's fine, right? So they feel like, oh, the doctor said it's fine. And you just see, touch the baby, and, you know, play with the baby, and everything's fine. But here you don't have that. So culturally, over there, people go to the doctor more, not only for medical problems, but for, I would say, like, yeah, reassurance. It's like to feel better. And here is totally different.
Right. Yeah. I also have another comment. What is some advice you would give for a woman or a female who's looking into pursuing a career in the medical field? And does that different in Venezuela, where is there like a difference between male to female ratio who pursues these fields, or
Okay, like my professors over there, I remember all of them, not all of them, but like 80% of them were males, right? And but my classmates, they were like 60% females and 40% males. And we used to talk about that. It was more, it wasn't, like before, people, women will stay home, but it wasn't like oh no, you're a woman, so you can't study. It was more like, yeah, it was like a cultural thing. But like my generation is like the same, or even more women go to medical school over there, and in Mexico too. Like, now here I can see the difference here, because it takes so much money and so much time. I can see why women are like left behind, because if you want to have kids, if you want to have a family, and you are 30 years old and you're barely getting into medical school, right? And so I can see a problem there. But me, for example, I graduated when I was 22, so I was ready to work at 23 over there. So is here is I can see why it can be like a difference.
got it, thank you. So I know
Yeah.
I've been asking away, but do
Oh, no problem.
anyone here have any additional questions, any thoughts, any comments?
No.
So I have a
Huh?
question and a
Yes.
comment, and I'll take myself. I apologize, y'all. Like normally we were in a program, we were on campus, I'd be a little bit more professional, but it's business casual right now. And I just got
Yeah.
done walking outside. So I apologize, Dr.
No
Corona.
problem.
Thank you so much, by the way, for joining us. I mean, this is what a really an honor to have you here, and we need to
Thank
have more
you.
conversations like this. So I'm bummed that we couldn't get more students, but I'm happy that Janelle and Brian are able to join us and listen. So I'd love to bring you back potentially, maybe when we're back on campus, and we can have some more folks, witness you. So I,
Yeah.
I did have a question. I guess do you practice here? I mean, I know you said that you teach. Are you practicing as well, or are
No,
you
I
mainly teaching?
try I tried to get into the residency to get my license, and I
Okay.
couldn't. So I became a professor and a teacher. So
Okay. Okay.
yeah,
Gotcha. What
yeah.
would you say then? I mean, I have a good family friend that just became a family practitioner in Palm Desert, I think, or Coachella
Uh-huh.
Valley, something like that. and he went to UCR medical school, and he
Yeah.
just finished his residency, and he just got like a full-time position. So, and I actually found out what his salary is going to be, which I thought was a trip. So he's making decent money. He's over 200,000
Mhm.
and some change. But what I find interesting is he's got so much debt though. So I mean,
Yeah, like
it's just like he and I are basically almost making the same salary, because he's just like,
yeah,
and he
that's
has a
the
mortgage, and they want to start a family. So it's just interesting. But can you comment on the Inland Empire and Riverside County specifically, in terms of just like locally what you see as kind of barriers, I guess, for people receiving like equitable health care in general, other than the fact that we don't, have really health insurance for people, like free medical care, but
yeah. So in Riverside County, we have a lot of Latino population and like low income. Oh, I'm sorry. Like more low income, and like they have programs like Medicare and Medical, right? Sorry. Uh, they have programs. I'm sorry, I'm talking. They have, sorry, that's my husband. um and they have the insurance that they have is Medical, Medicare. That's the primary insurance in Riverside County. And I'm not saying it's bad, but that's the only government insurance that there is available for them, right? And when it comes the time to get good service, or for example, I'm gonna tell you, like my dad, for example. I told you he has a tumor in his brain. And when we find out last September, I knew we had to do the surgery fast, and everything needed to be fast. And he has Medical. And I know for a fact that for him to get a doctor's appointment, it was going to take 3 weeks, and then to be approved for surgery, it was going to take, I don't know how much time. So I went to Tijuana. I went to Mexico, and he was diagnosed. I know something was wrong. He was having seizures. He was diagnosed in 3 days, and in 3 more days he was having the surgery. Of course, I pay $15,000 for the surgery.
15 or 50, 50?
15, 1 5,
Oh, 15.
1 5, but
Wow.
for brain surgery, freaking brain
That's a
surgery.
bargain.
Yeah, yeah,
Wow.
for brain surgery.
My wife
And
had brain surgery a couple years ago, and it was an $80,000 surgery.
there you go. And well,
Yeah.
so I knew, because he has Medical, right? Now he's back with me. And like the beginning of his treatment, I did it over there. But if he needs another surgery or another like emergency treatment, I think I will take him back over there, because I can't wait for, like, this is a very aggressive cancer. Okay, so that's the difference. People here to get treatment, like you get treatment, right? But you have to wait. Like, for example, an MRI over there in Tijuana, it was like $200 an MRI. Okay, but but he will have the MRI. Like, I will pay his $200. Here's my MRI. And I've been trying to get an MRI for him for the last 3 weeks,
Wow.
because he had an episode, and he needs to be approved, the MRI. And if I don't have the MRI, the doctor can't see it, because why are you here if you don't have the MRI, right?
Right.
So yeah, that's the big problem in communities like this, that where the primary insurance is Medical, Medicare, and all that.
And doctors don't get reimbursed as much, right? Like,
No, and they know
right.
that it takes longer. Like, when they see a patient with Medical, it's like, "Ugh, okay, I know this is gonna take forever for them to pay me and stuff." So
Wow.
yeah,
Thank you. Yeah,
no
that's
problem.
incredible. I mean, I've had my own issues with healthcare, and the privilege that, yeah, I mean, insurance is everything. And we have decent insurance in our, in the public school system, right? And like the
Yeah,
public university system,
yeah,
but even that varies by institution.
yeah.
The state systems aren't nearly as good as private universities. Private universities
Hmm.
tend to have better insurance. So anyway, excellent. Well, thank you. I
Yeah,
appreciate that. I'll stop in case
no
anybody else
problem.
has any questions.
No problem. This is
I'll go ahead and read it out loud
Yeah.
since we are recording for our YouTube channel.
Yes.
So, in the chat, we have this is a sensitive question, but I've heard or seen stories of people experiencing negative bias when receiving healthcare. Have you personally witnessed another colleague that discriminated or assumed a patient's condition based on a stereotype when providing for their care? I am curious how often that happens. Uh-oh, Dr. Corona, I think you're frozen. Can you hear me?
Technical difficulties.
Yes, technical difficulties.
Well, if you can hear us, Dr. Corona, please sign back out and sign back in. Maybe that might help, or maybe disable your video. I know sometimes the video background ties up the computer a lot, unfortunately.
That was a great question. Thank you so much. Okay, so I think she's logging in and logging back out.
Yeah.
Yeah, I mean, that's a really good question. I'm not an expert in that field, so I'll hold my thoughts, but
So I can share something. I mean, we all have, I think, personal stories where we felt like
mm-hmm,
we've been discriminated against within the healthcare system. I can
mm-hmm,
honestly say, Janelle, like, so when I was at UC Irvine, this was when I was like, I don't know, 20, 21 years old. I was going to the student health center, and I was going, I don't remember for what. I think I had a cold or something, or I had pain. I've had ovarian cysts. I mean, now I had a hysterectomy, so I don't have that anymore. But back then, when I was a younger person, I had ovarian cysts, and they're painful. And so I was visiting the doctor, and when he was going over some tests, and he was talking to me about it, and he's like, well, you're also a little, he started to ask me questions about my weight. And he's like, you could also, do some exercise. Like, what do you do for activity? Which is all fine, whatever. But then he started talking about diet, and then he made the comment, and I'll never forget this. He made the comment, well, I know it's probably difficult for you and your people because you all tend to eat a lot of carbs with burritos and cheese and, carnitas. And I
mm-hmm,
kid you not, I literally thought he was kidding, and he wasn't. He absolutely was dead serious. He happened to be an older gentleman in his, like, I don't know, 70s, 60s, older white dude, I will say. And I remember just feeling like shocked that he said that. And I think I just mumbled something like, I guess, like, what are you supposed to say to that? And I remember just feeling so furious, but also just like shocked that a doctor would say that to
mm-hmm,
me. And so I ended up going to the counseling center because I had a connection there anyway because of the LGBT center, which is a reason why y'all need to take advantage of your resource centers. Like, seriously, because I went into the LGBT center later that day or the next day, and I was still upset about it. And I was talking to one of the people in there, and they're like, you should go talk to like the counseling center about it because this is traumatizing, right? And so I ended up doing that. And sure enough, like my supervisor there, or the supervisor there at the counseling center, happened to also be an advisor for the LGBT center. So I knew her, and she was super cool. And she's like, I described what happened. And the way that university systems work is that the student health centers are often connected to the counseling centers. So just like how MSJC, like we have our clinicians, well, our Dr. McAllister is the one who technically supervises them. And so it was the same thing at UCI. And it's often like this at a lot of the UCs, whoever like is the supervisor for that like particular health center will often be tied to the counseling center. Anyway, and so sure enough, when I told the counselor there, who happened to be one of my advisors, she knew who the person was. She knew who the doctor was
mm-hmm,
immediately. And she's like, I can't really share anything specific, but just know you're not alone. And this has happened before. And she urged me to file a complaint, a formal complaint. So just like, we have a grievance process. They have the same thing at most UCs, every university. And I didn't do it. I didn't do it because number one, I didn't want to deal with it. I was too
mm-hmm,
embarrassed. Totally. Yes. I was like uncomfortable. And I
mm-hmm,
told her so. And I'm like, I don't even want to deal with it. I'm barely struggling to stay a student as it is. And so I never did anything about it. And I later found out that he retired amidst other complaints. So I totally wasn't the only one. And, I mean, I think in the end it helped the student health center there at UCI because I think they had to go through a lot of training afterwards. But
mm-hmm.
man, it was an experience. So
That's terrible. That's
yeah.
terrible. Talking about not being able to connect with your patients, right? Providing them that one-on-one care. I know I could also reference the language barrier. That's a huge deal. Not being able to even communicate properly with your doctor. That's also a huge issue. Our last Eagle Talks, we had also a student in the medical field who her name's Priya, and I'm sure that's on our MSJC SLDP YouTube as well. She mentioned that she's learning Spanish. She's hoping to learn Spanish to be able to better connect with the patients that she serves. So to me, that's extremely admirable and something that I feel is a great strength to being able to connect with your patients.
Yeah, no kidding. It's amazing when you have bilingual like if you need, if you speak a second language, to have that bilingual communication is like super important.
Yeah,
Um,
especially when it comes to your health, that's really important. I received a message from Dr. Corona. She mentioned that she's still trying to
okay.
get back on.
Yeah, the internet's been weird today. Um,
Yes. Yeah. And in Paris, actually, good thing I'm not working from home. The internet is really bad out there, I heard.
really.
It's been
You,
gone. Yeah.
mm, oh, that's right. You're still on campus, Marisol. I was like, wait, what do you mean? Like, oh yeah, it's Wednesday.
Yeah.
Um, Gosh, it would be great to get Dr. Corona back here to do another
Mhm.
program like for the fall.
Oh,
I think it's a
she's
valuable.
she's coming right back in.
Yay. Thanks for being here, Janelle.
Yes. We really appreciate it,
Or it's
Janine.
actually
I'm back.
really, really interesting.
Good,
Sorry.
I'm glad. I'm glad. And thank
Sorry.
you, Dr. Corona, for coming right back on.
No
Um,
problem.
we really wanted to have you back on. We still had some few more comments to
Yeah,
address.
I remember the question before.
Okay.
So, so discrimination, somebody was asking about that.
Yeah, I'll go ahead and retype the question if you need to
Yeah.
look at it again.
Yeah. Stories of people experiencing negative bias. Yes, yes, yeah, I have witnessed that. Um, well, it's obvious that I look pretty white, right? And I have green eyes until I talk. You can see my heavy accent, right? And once again, like I'm gonna go back to my dad's situation. Um, Taking him to the doctors here, they don't look at you like, I don't want to say, like, when he opens the door, for example, he was like, okay, welcome, my name is Dr. So and so, and what's the problem, right? And then he starts typing. So I feel that he's in a rush, so I want to talk in a rush, right? I feel like, oh my god, I'm sorry, like I'm bothering you, right? You get that feeling of, oh, and
Mhm.
I'm like bothering you, right? So I talk fast, and then and he's like typing, and he doesn't touch my dad, which I'm used to it, right? And so I give them the exams and stuff, and then I start explaining to him, and I'm using medical language, right?
Mhm.
And then he stops, and then he looks at me, and I say, oh, it's because I was a medical doctor, right? And right away he was like, oh, okay, so let's talk, right? So I felt
The mood
I don't,
change.
the total change. It was like,
Mhm.
oh, so and my dad, he looked like a, um he had a big beard, because he doesn't want to shave anymore. He's skinny. He was like walking like an old man, and I was like holding him,
Mhm.
and so he was like more calm, and then he was like his body changed, or like,
Mhm.
and I felt he treated my dad better. Like right
Mhm.
away he started like examining
Mhm.
my dad,
Mhm. Yeah.
and I remember coming back home and telling my husband, wow, like, this is how people get treated every day,
Mhm.
at, at least Latin people,
Yeah.
it's
Like in
like,
the
okay, what's your problem?
yeah.
Okay,
Mhm. Mhm.
so yeah.
Yeah. No, I totally agree with that. And in the chat we see, wow, he started respecting you once he knew your
Yeah,
credibility.
so I saw his body, like he was typing, and then he was, oh, so tell me more. Like I was able to, like, talk about my feelings and everything,
Mhm.
like
Wow.
he was giving
Yeah.
me advice about things that, like, what to do with my dad and things like that,
Mhm. Mhm.
and even he asked me like what my dad did for a living, and my dad was a physics teacher. So I said, oh, he was a physics teacher. He was like, oh, so more respect there, right? If I
Mhm.
say, oh, my dad was he cleans toilets, like, I you just feel it. It's something
Yeah.
different.
Yeah, you wonder what that relationship would have looked like, right?
Yeah, with
Mhm.
yeah.
Yeah. Okay, really good. All right, so we're heading towards the end of our time here. Do we have any final thoughts, questions, concerns for Dr. Corona?
Dr. Corona, I'm wondering, like, what's your best advice for students who, like Janelle mentioned in the chat earlier that she had thought about potentially going the route of being an MD, but then I think she talked about potentially going to nursing or having that be more of her focus. What would be your advice for
Yeah.
folks, for students who wanted, really want to pursue being an MD, but,
Mhm.
it's, yeah, all the things that you talked about.
So my advice here to be, if you want to be an MD, it's because I teach high school students in Temecula, and I teach in MSJC, right? The mindset of people in Temecula that they want to be an MD is, I want to get extra credit classes, and I want to be the super A plus student, right? And to get into an MD program here, you need to be more than that. Okay, you need to have extracurricular activities. You need to show up that you are more than your grades. Okay, so I will, if you want to do it here in the United States, I advise you to start building like your curriculum towards being an MD little by little. For example, I have a medical assistant program, and well, it's new. I opened a medical assistant program in my high school, and you can start by being exposed. It's really like, for my kids, it's gonna be free, right? But the medical assistant programs, those are programs that you can complete in 1 year, or a CNA program, right? You complete that and you get exposed to the healthcare, okay? And that's how you know if you really want to be an MD. You get exposed to, and you build your curriculum. You are more than just grades, okay? And then, and you can make a little bit of money just working as an MA or as a CNA, right? And then you can, go to college at the same time, and you can work your way up. But if you don't want to do that, you can, if you have the possibility to go to medical school in the Caribbean or in Mexico too, which is way cheaper, right? If you have family that you can stay over there for, I think medical school in Mexico is 7 years, the same as my country, 7 years. Yes, certifying nursing assistant. I think you can be a CNA for in like 6 months or less. And after the pandemic, that was one thing that I wanted to talk about. After the pandemic, wait, I want to show you guys something. This is from the Department of Labor. Let me see if I can share my screen real quick. This is something
You
that I
should
wanted
be
to share.
good to go. There you go.
Yeah. So wait, let me move this. This is from the no. Wait a second. Let me close this. Present. This is from the Department of Labor. This is from September last year, right? So these are all the occupations, like fast growing occupations from 2019 to 2029. And you can see these are the 10 fastest growing occupations. 6 of them are in the healthcare system. So nurse practitioner. They have, let me see, occupational therapy assistants, CNA. These are CNAs actually. Home health and personal care aides, physical therapists, medical and health service management. So these are like occupations that are growing fast. And well, you can see the projected growth 36%, occupational therapy 31%. So these are things that in the next 20 years they're not going to go away. So this, if you want to be in the healthcare system, right now is the time, especially after the pandemic. So
Very good.
yeah.
Thank you for sharing. Okay, so Dr. Corona, we really appreciate your time. Once again, I'll be sure to upload this recording to our YouTube page and make sure that, students are able to check you out and like Maya mentioned, we'll have to have you come back once we're back in
Sure.
person here.
Yeah.
So we really appreciate that. And Maya, did you want to provide some closing thoughts, comments?
Yeah, I mean, just honestly, like it's great to have your feedback, especially with the international aspect, right? Like just the fact that there's so many different ways to get an education. And I think we're
Mm-hmm.
so centered, the US is so centered on how we do things. And in reality, we actually have a lot
Yeah.
to learn from other countries
Mm-hmm.
who've done it better and who've done it first, right? So
Mm-hmm.
yeah, I would love to bring you back, Dr. Corona. I think it would be a great opportunity maybe to have we can talk about so much, right? So I guess what I would ask, like, what would be something that you would want to maybe expound on for future programs, or what are kind of some hot topics? You mentioned that it's a really good time to be starting a career potentially in the medical field. Like, what are some
Yes.
some
It is
things
a
that,
great
yeah,
it is a great time to start a career because the government, they put, after the pandemic, they put a lot of money into equipment, into, like, there's a lot of money, and they are projecting like 200 nurses are going to retire in the next 3 years. And
Oh, Dr. Corona, you're cutting off a little bit again. Can you hear us?
yes.
Okay, we could hear you now. Go ahead. Oh no, we lost you again.
yikes,
I
bummer.
know. Dr. Corona, if you could hear us, if you could try shutting off your video, maybe that might help for a bit.
Yeah,
Uh-oh.
maybe coming back on.
Yeah.
Okay.
In the meantime, thank you to Suzanne, my colleague, for joining us. We appreciate your support.
Happy
Let's
to be
see.
here.
Thank you, thank you. And Janelle, of course, our MVP guest of the day.
Janelle, what's your goal right now specifically?
So I'm planning on doing the MSJC nursing program or just a community college nursing program because my dad is an educator at his hospital. So he's seen like all the students and what they've done. And apparently that community college, you don't get student debt when you go to their nursing program. So I'm planning to do that. And I know it's super competitive. So I'm working my hardest to get in. But yeah, I'm just working towards a registered nurse for now. But I want
Registered.
to eventually be a nurse practitioner, but that's a while. So I'm just doing what I can do best right now.
And how many more semesters are you planning on having at MSJC?
Actually, this is technically my last semester, but I think I'm going to take another semester since the nursing program in MSJC is still not accepting applications. So I'll just
Mm,
take extra courses like nutrition or something to boost my knowledge, I guess.
yeah. You can take electives too. I mean,
Mm-hmm.
like fun classes, I suppose.
True.
Okay, that's cool. And where were you planning? So, but you're trying to get into our program, and if you're not able for whatever reason to get into our program, what would be your next, I guess, plan?
I'll try the other community colleges like
Okay.
Palomar and RCC, or like even go to San Marcos, but that's like my last resort. So yeah, that's the plan at the moment.
Cool.
That's awesome. We're really proud of you, Janelle.
Thank you.
We're recording, right?
Yes, we are
Okay.
recording.
All right. I'll save do we want to give, I guess, Dr. Corona a minute or two, or what we could do
Um,
is, yeah.
we can go ahead and close it out. And if she pops in, then we'll have her give her finishing statements. But I ultimately just wanted to thank all our guests for being here today and keep an eye out for our next Eagle Talk series. We will have more in store for you all. Maya,
Yes.
did you have any
Just
closing
stay
thoughts?
tuned. We'll have some other programming, I think, centered on the health field, especially given everything that's happened this last year. I
Hmm.
I I think I'm hopeful that we will have some more programming specifically centered on just anything related to healthcare or wellness, because it's such an important topic. So my hope is that Dr. Corona can come back,
Hmm.
and that's what I was going to ask her, like, specifically, what are some topics maybe that she can come back and talk to us about some more.
Hmm. Definitely. All right. Well, thank you all so much for celebrating World Health Day with us and have a great rest of your evening. Thank you.
Hey, Janelle, stick around.